You never think about it until it happens to you. Hair loss, it can have a particularly damaging result on your overall aesthetic. And it's something that feels so out of your control. And I know that that is a huge thing, is just this feeling of complete frustration. Yes, there are, there's various, topicals and over-the-counters and even some prescription medications that can have decent results, but, I wouldn't be doing hair transplant if those things worked all that well. The reality is that a majority of patients are still finding themselves frustrated. At present, we are not able to multiply follicles in any way. So the follicles, the hairs that we take from the back of the head, those hairs are gone. I describe it to patients as if you think of the back of your hair like a forest of trees, it's like diluting the forest. Yeah, you take a tree here and there and place it somewhere else, but as you look over the forest from an aerial view, you don't notice that maybe upwards of 2,000 trees have been moved. I hear this question all the time from my patients, which is, well, doc, I'm losing my hair, it may be my frontal hairline, wherever it is. I'm losing my hair. So, yeah, I hear you. You can take hair from back here and put it up here, but who's to say I'm not just going to lose that hair, 1, 2, 5 years from now? And the answer is, you're not going to lose that hair. We don't tend to lose the hair in our sub-occipital region. So those hairs, those follicular units, are not, shall we say, pre-programmed to die, like, unfortunately, a lot of our hairs are in the frontal hairline. Hair transplants are not what they used to be, and they look good now, they look natural. Within a week, you almost cannot tell anything was done.